Hey Kendra, how's it
Hi.
going? Thank you for
Good.
coming in. It's always a pleasure having you.
Thank you.
I have some really good news for you.
Okay.
After reviewing what we found, I think you're the perfect candidate for chiropractic care.
Awesome.
I can't, guarantee that we'll fully resolve your issues 100%. But in previous cases that I've seen, patients with similar issues that have come in, we've had great success in treating them. So that's a
Awesome.
really good sign.
Okay.
I kind of just want to revert to what I stated in our initial exam and kind of, re-emphasize the importance of our nervous system.
Okay.
As I stated before, our nervous system is the most important system of our body.
Mm-hmm.
It controls and regulates every cell and tissue that we have. So we started off with our brain,
mm-hmm.
and off the brain we had the spinal cord,
mm-hmm.
and then off the spinal cord we had the nerves, correct?
Yeah.
Right, so when all this is functioning at an optimal level, our body is not subluxated. So
okay.
that's the kind of state that we want you to be in.
Mm-hmm.
But when our body is subluxated and there's any type of pressure on these nerves, our nervous system isn't able to function at an optimal level. And so those cells and tissues that are being innervated are going to have a decrease in flow and a decrease in function.
Okay.
So I kind of like to use the analogy of a major highway. We have on and off ramps that, kind of go onto these major highways. And when those are open, traffic's able to flow smoothly.
Mm-hmm.
But say we have some construction going on and one of these on and off ramps is closed, then we kind of see a backflow of traffic.
Yeah.
This is much like a subluxation. We see a backflow of nerve function. And so those cells and tissues aren't able to function at an optimal level.
That makes sense.
And so in reviewing your case, I found that there's some mild disc thinning at L3, 4, and 5. And this is, this is something that we see as we age. It's common to see that disc thinning. And we also see that you're having some osteoarthritis
Mm-hmm.
in those same levels. And it's with osteoarthritis, we see some bone spurs kind of come on. And this is common in the aging process. And so what's that doing to you? It's causing a biomechanical change throughout your body.
Okay. And
so your body's kind of trying to live with this change, and it's altering your posture. And what's that doing? It's causing this canal right here to be occluded,
mm-hmm.
and it's putting pressure on that nerve. So that's why we're seeing that numbness and tingling going down your leg. And so what I'd like to do now is kind of, go over our plan of attack with you.
Okay.
So in this book, we see that there is 3 stages of healing, right?
Mm-hmm.
So right now you're in the acute stage. And our goal for this stage is to kind of bring you relief from your pain and your symptoms,
mm-hmm.
specifically the numbness and tingling that you're experiencing down your leg.
Yeah.
And so during this stage, I want to see you 3 times a week for the next 2 weeks. And when you come in, we're going to do a technique called flexion distraction.
Okay.
This is going to specifically address that numbness and tingling. And once we see that numbness and tingling kind of go away, then we know we're kind of moving into the next stage of healing, which is our supportive stage.
Yeah.
During this stage, we're going to, perform the chiropractic adjustments. This is where we're going to start introducing chiropractic adjustments and laser light therapy.
Okay.
And our goal with the chiropractic adjustment is to kind of restore some flexibility and motion, along with kind of getting some increase in disc height.
Okay.
And with the laser light therapy, our goal is to treat the bone spurs that you're experiencing with the osteoarthritis.
Okay.
So this is kind of the stage where we're going to support you while you heal. Once we kind of move from the supportive stage, we're then moving into a wellness phase. This is where I kind of want to address your posture,
mm-hmm.
Focus on your diet, but I do want to continue our chiropractic adjustments. These are just to kind of maintain a subluxated free spine so that your nervous system is able to function at an optimal level.
Okay, awesome.
And so I kind of want to give you this book to take home and read.
Okay.
Because there's a lot of information in here that I think can be useful for you.
Okay.
There's stuff about our diet, It kind of tells you what foods are really good for you, and it
Okay.
also tells you what foods are kind of inflammatory to our body and stuff that you don't need.
Awesome. Thank you.
Along with that, there's also some really good postural exercises that you can do at home,
Mhm.
and it also kind of shows you your sleep patterns and things you can focus on outside of our office that will optimize your health.
Awesome. Thank you.
So
much.
that's for you to take home. Now, as far as payment, we are a cash practice, so we charge $70 for the services we provide, and that payment's taken up at the front desk. And they should let you know when your next scheduled appointment is, and that's all I have for you. If you have any questions or concerns for me, I can address them. So, any questions?
Is it $70 each day?
It's $70 a visit. So.
Okay. Awesome. Thank you. That's all.
Perfect. Thank you.
Thank you.